Toxic epidermal necrolysis, or TEN, is a rare, life-threatening skin condition. It's considered a severe form of a drug reaction, although other factors can contribute. TEN causes widespread death of skin cells, leading to the separation of the epidermis, the outer layer of skin, from the underlying layers. This can leave large areas of raw, exposed skin, making the body vulnerable to infection and dehydration. Think of your skin as a protective barrier. TEN disrupts this barrier, leaving your body open to serious complications. Because of its severity, TEN requires immediate medical attention and often involves hospitalization in a specialized burn unit. While TEN is a frightening condition, understanding its causes, symptoms, and treatment options can empower patients and their families to seek timely medical help and navigate the challenges of this disease. The most common cause of TEN is an adverse reaction to medications. Certain drugs are more likely to trigger TEN, including antibiotics like sulfonamides, penicillin, and cephalosporins, anticonvulsants used to treat seizures, nonsteroidal anti-inflammatory drugs, or NSAIDs, and allopurinol, which is used for gout. However, not everyone who takes these medications will develop TEN. It's often difficult to predict who will have this severe reaction. In addition to medications, other factors that might play a role in TEN include infections like viral infections and pneumonia, genetic predisposition, and a weakened immune system. If you have concerns about a medication you are taking, especially if you have a history of drug allergies, always consult your doctor. TEN often begins with flu-like symptoms, such as fever, cough, sore throat, and muscle aches. These initial symptoms can be misleading, as they mimic common illnesses. However, within a few days, the telltale signs of TEN begin to appear on the skin. The rash typically starts as painful red or purplish patches that resemble a bad sunburn. These patches can quickly spread and blister, eventually leading to large sheets of skin peeling off. The mucous membranes, such as those in the mouth, eyes, and genitals, can also be affected. TEN is a serious condition with potentially life-threatening complications. The loss of skin creates a pathway for bacteria and other germs to enter the body, increasing the risk of severe infections such as sepsis, dehydration, electrolyte imbalances, and organ damage, including the liver, kidneys, and lungs. The severity of complications often depends on the extent of skin involvement and the overall health of the individual. Early diagnosis and aggressive treatment are crucial for improving outcomes and reducing the risk of long-term health problems. Diagnosing TEN often involves a combination of several steps. First, there's a medical history review. Your doctor will ask about your symptoms, the medications you're taking, and any history of drug allergies. Next, there's a physical examination. Here, your doctor will carefully examine your skin and mucous membranes, looking for characteristic signs of TEN. In some cases, a skin biopsy may be necessary. This involves taking a small sample of skin and examining it under a microscope to confirm the diagnosis. It's important to distinguish TEN from other skin conditions that may have similar symptoms, such as Stevens-Johnson syndrome, or SJS, which is a less severe form of the same disease process. Section 6. Treatment strategies: stopping the damage and supporting healing. Treating TEN usually requires hospitalization, often in a specialized burn unit or intensive care unit. The primary goals of treatment are to stop the progression of skin damage. This often involves immediately stopping any suspected medications that could be causing the reaction. Provide supportive care. This may include wound care, keeping the skin clean and bandaged to prevent infection, pain management, intravenous fluids and electrolytes to prevent dehydration, and nutritional support. Control inflammation and boost the immune system. In some cases, medications such as corticosteroids or intravenous immunoglobulin, or IVG, may be used to suppress the immune system's overreaction. Early and aggressive treatment is essential for improving outcomes and reducing the risk of complications. Section 7. Living with TEN. Practical advice for patients. Coping with TEN can be physically and emotionally challenging. Here are some practical tips for patients and their families. Be patient with the healing process. It can take several weeks or even months for the skin to fully heal. Follow your doctor's instructions carefully. This includes taking medications as prescribed and keeping all follow-up appointments. Practice good hygiene. Wash your hands frequently and keep your skin clean and dry to prevent infection. Protect your skin from the sun. Use sunscreen with an SPF of 30 or higher and wear protective clothing when outdoors. Stay hydrated. Drink plenty of fluids, especially water. Eat a healthy diet. Focus on nutrient-rich foods to support healing. Seek emotional support. Coping with a serious illness like TEN can be stressful. Don't hesitate to reach out to family, friends, or a therapist for support. Remember, you are not alone in this journey. With proper care and support, you can overcome the challenges of TEN and move towards recovery. Section 8. Hope on the horizon. Advancements in TEN. Treatment. While TEN remains a serious condition, there is hope for the future. Researchers are constantly working to better understand the underlying causes of TEN, which could lead to more effective prevention strategies. Develop new and improved treatments, such as targeted therapies that specifically address the immune system's overreaction. Improve early detection methods, allowing for faster diagnosis and treatment. With continued research and advancements in medical care, we can strive for better outcomes and a brighter future for individuals affected by TEN. Section 9. A final word. Early detection and care are crucial. Toxic epidermal necrolysis, or TEN, is a rare and severe skin condition that demands immediate medical attention. Recognizing the early signs and symptoms, understanding the potential triggers, and seeking prompt medical care are vital for improving outcomes and reducing the risk of complications. While TEN can be a frightening diagnosis, remember that with early detection, aggressive treatment, and ongoing support, individuals can recover and go on to live full